So today I will not be talking in detail. I'll just be talking briefly on tobacco and cancer. We've seen so much about prevention of cancer. What is surprising, actually when I prepared this presentation, what I found surprising was that such a preventable cause as tobacco, which the numbers which I'm going to put up to you now are staggering. So if something as simple as tobacco use can be prevented, if we can spread the word, then possibly we can prevent a huge load that it causes on cancer and death in this country. So we all know that cancer is a big problem today. It causes around 12% of all the deaths worldwide, and it is the third most common cause of death. And just to give you the numbers, it causes 3.8 million causes of death every year. In India, we have to know that 2.5 million people are suffering from cancer at any point of time, and 7 lakh new cases are diagnosed every year. The incidence rate, like we have already known, is around 44, is slightly higher in females, and the mortality rate is also very severe when it comes to just cancer. And what we have to know is tobacco is one of the highest known causes of cancer today. Among all the known causes of cancer, tobacco causes so many cancers and in such high numbers that tobacco should, and from today I think we should all take a vouch that we should prevent the tobacco use in any form among all our patients, relatives, and in the community. It is one of the primary risk factors for cancers, and it has been ranked 4th. This is a CDC study which says it's the 4th most preventable health risk after malnutrition, unsafe sex, and high BP. So this is one of the causes which you actually are paying money to destroy yourself. And smoking has been linked to more than 70% of cancer deaths worldwide. And what we all most probably don't know and we don't take so seriously, somebody else is smoking, he's killing himself. 30% of deaths are caused by passive smoking. And we have to know, we all know, I think most of us are aware that lung cancer is linked to it. And what is not very commonly known, I think even among medical practitioners, is that even far away organs, as far away as the bladder, is associated with cigarette smoking. Smoking and alcohol also lead to cancer of the esophagus, and in India, we see a large number of squamous cell cancers which are mostly caused by smoking and other forms of using of tobacco. So tobacco causes a very wide repertoire of cancers. It's linked with lung cancer, oral cavity cancers, many cancers of the head and neck. Breast cancer has been known to be associated with people who smoke, and also other tumors in the genitourinary tract like the kidney, urinary bladder, and also pancreas. What should also be known is that environmental tobacco smoke, another form of calling passive smoking, also leads to an increased risk of cancer. Something as indolent as this is one of the major cash crops from India today, and more than half of Andhra Pradesh survives on tobacco leaves. But such an indolent looking plant looks very green and nice, can lead to so many forms of difficulty, death, and morbidity. And tobacco, the various forms of use of tobacco, it is only limited by human ingenuity. You won't believe the ways in which tobacco can be used. In India, most commonly we classify tobacco use in 2 ways. One is smokeless tobacco and the other is smoked tobacco. Unfortunately, especially in southern India and to a large extent and also in the Gangetic belt, smokeless tobacco is very common, which is associated with oral cancer and other head and neck squamous cell cancers, while smoke cancer is more common in the West. Among the smokeless cancer, we have chewing tobacco. Chewing tobacco today has got so many forms. It's called Zaini, it's called Zarda, it's called, you have all these in packets, you have it in sachets, you have it in boxes. And snuff. Snuff is something which need not be chewed, it's so finely powdered, such that the tobacco contact with the mucosa itself leads to intoxication and tobacco addiction. Smoked cigarettes, there are many ways. The commonly ones which are used are cigarettes, cigars. Indian ingenuity is BD, where the tobacco is rolled in cigarette. What is not known and what was actually a fad, right now what's happening in the United States at least, is that people are not smoking cigarettes and they feel that smoking cigars and BDs, you won't believe it, United States BDs are being available now, that smoking cigars and BDs reduces your risk of getting a cancer. But what needs to be known is that actually cigars and BDs have got more unrefined carcinogens going into them and they actually lead to higher chances of getting cancer. So what is tobacco all about? Tobacco has around 800 ingredients, and we have to know that more than 70 of these are pro-carcinogens, and believe it or not, another 300 of these are co-carcinogens. I'll come to it in the next slides. And what is amazing is that nicotine, which causes the addiction to cigarettes itself, is not a carcinogen. So the products, I just got this picture of the net, and what is interesting is that what are the different products are actually coming from all the different things which you don't like. So actually you're taking acetic acid, methane, what is commonly produced in sewer gas, is one of the toxicants of tobacco. Then you have arsenic in tobacco, and then you have carbon monoxide, you have nicotine, and then you have ammonia. If you actually see the individual uses of all these compounds, they are very funny. You will actually be using, you are smoking into toilet cleaner and insecticides. So the carcinogens per se, from the oncologist point of view, we have very many carcinogens, but the most common one which is needs to be known, the polycyclic aromatic hydrocarbons and NNN. Others are there which are being identified every day. And the basic action that it does is, you have two types of carcinogens. Both of them are seen in cigarette smoke and in tobacco products. One of them is a pro-carcinogens, which cause initiation of DNA damage in cells, converting them into cancer cells. And then you have promoters, or which are called the co-carcinogens, which actually can cause additional mutations in these initiated cells and cause you to have a progression to cancer. So this is just the flowchart of how cancer occurs in tobacco. And what we need to know today is second-hand smoke. Today there is a separate terminology coming up for passive smoking, which is called second-hand smoke. And we have to know the second-hand smoke is mainly divided into two types. One is the side stream smoke, and the other is the mainstream smoke. The side stream smoke is the smoke that comes from the cigarette which is not being actually smoked, while the mainstream is what is being exhaled by a person who smokes a cigarette. One more thing, why do we have to know so much about nicotine and smoking? We have to know that nicotine addictions, getting away from tobacco, will have major and immediate health effects. Not only related to cancer, it is related to a lot of other things. Today we are talking only about the cancer risk, but it has an immediate effect as well. And also, in the long run, it reduces the risk of cancer. So if you quit smoking, it decreases the risk of smoking and other lung and other cancers. And earlier you quit, the higher is the health benefit. So if one were to quit at 50 years, then the person, he reduces his chance of dying in the next 15 years by half. Today when we're talking about stopping tobacco, we have to know that which is the population that we have to target. We have to know that majority of smoking starts by the age of 19 years. So the crucial people who we have to target and cause awareness regarding tobacco addiction is in the teenagers and young adults. And we have to know that that is when the disease initiation and progression, it depends on the number of years that the person is actually addicted onto tobacco. And so if we can prevent it at that age, we prevent many premature deaths and increase productivity as far as our society goes. So this is just the treatment for tobacco cessation. It is basically into 4 different phases. You have to, initially it starts with the contemplation by the patient, and then pre-contemplation by the patient goes on to contemplation, and then you have to actually put it into action. This is where actually physicians are going to help them, and then this leads to short-term success. But we have to know that short-term success is not the end for tobacco addiction, and you have to convert all these patients into a long-term success where they are off their addiction for a long period of time. But what today is preventing all this, so much I'm talking about, but why are people still paying money and doing this? We have to know that tobacco companies today are one of the largest income generating sources for our government and for our company and for our country. So maybe we'll have to, legislation is not being so strict, but as healthcare practitioners, we may have to possibly spread the word that nicotine addiction is something which should necessarily be stopped at an urgent basis to prevent this cancer and cancer related deaths. So today, just the take-home message for most of you is no smoking and no tobacco. Thank you very much.